Hey, good morning and good afternoon, everyone, depending on where you are. I am Prentiss Rhodes, and we are here with NASM Facebook Live. And today, I have one of my regular panelists, Wendy Batts, and we have another special guest, Marty Miller. You may have seen him as an NASM MI or with his work with Techno Gym or in his special segment, Coffee Talk with Marty. So welcome today, Marty. And today what we're going to talk about is we're going to talk about OPT myths, assessments, and we're going to answer some of your commonly asked questions about the model. So before we get going, everybody knows a lot about Wendy already. We've seen her quite often. She's professor mom, MI, the protector of all of us. But now, Marty, since this is the first time I've had you on, can we tell us a little bit about you and what you're doing now?
Certainly. So my background's in sports medicine, athletic trainer, strength and conditioning specialist all the way through, and then into NASM, obviously CPT, PES, CES. I also did the mixed martial arts advanced credentials. My background, like I said, been with NASM now for 15 years teaching. So it's been a while. So I've gone through all the content, helped develop some of the content, teach it all over. My current role is Director of Education and Training for Techno Gym North America. So that's what I've been doing the last 3 years now.
Okay. Outstanding. So why don't we just, because I know you have to, we're all on different time zones. We're all on different coasts, so I know you have to get out of here pretty quickly. So why don't we just start? And this concept is for both of you, and we'll start with you, Marty, since this is your first time on with us. Let's talk about a brief history of the OPT model, how that came to be, and why should we be using it in the first place?
Yeah, it's great. So I'm going to go back to how I fell in love with the model. So as an athletic trainer, my background was athletic injuries, trying to keep athletes healthy. It's not a matter of if they're going to get injured. By and large, it's when. So I had a lot of different concepts. I'd actually worked in professional baseball before I found the OPT model. So I knew about a lot of the components: static stretching, active stretching, dynamic stretching. I, of course, did assessments, but I didn't have a system. I was still trying to figure out how to put it together in a logical way that's reproducible. So I was working in a facility and I was looking for some continuing education back in, now this had to be early 2000s. And someone introduced me to NASM, said, you got to check this out. So all of a sudden, as soon as I opened up the textbook, I had this aha moment that, wow, all the information I had kind of scattered around is now been placed in a logical, systematic process based on science. So that's where instantly I was like, finally, I now can have a system that takes all the information I've learned and really lay it out into layers and know how to properly progress people. So the interesting thing is, once I went through it, I went through the corrective exercise. At the time, was named something different first. Then I went and did the certified personal trainer, and then went right into the performance enhancement, went through all of them, and then went through the master's program at Cal U, which was in its earliest stages, and I was in actually the first graduating class. But during that time, what I found interesting was when I found out where it came from. It was from Dr. Mike Clark, who was a doctor of physical therapy, and I learned what his background was, which was, similar, where he was working with a lot of professional athletes and put together a system that was evidence-based and that he could teach others to reproduce the same results he was having with these advanced concepts. So immediately I was like, just fell in love with the model, and still to this day, 15 plus years later, I've been teaching it for 15 years, I'm still finding new ways to use it. So that's what I love about it, is there's so much depth to it that I always am finding new and interesting ways to stick to the science, but apply it to every type of client I've ever worked with.
Okay, that's great. And Wendy, can you tell us the history from your perspective, how you came to the model, and how you're using it today?
Yeah, I think Marty did a really good job kind of summarizing why we use it today and pretty much every day. But my background with the history of it was I actually I had graduated from Arizona State. I was trying to find a job that was kind of in the exercise science realm, and there was a company that was looking for a female trainer. So I went and applied, and they actually dealt mainly with professional baseball players and football players, a lot of professional athletes, which when I actually went in to apply, I didn't know that at the time. And so they paired me with a mentor who happened to be Dr. Mike Clark. And so Mike was actually going through and doing a lot of the research. And so we were actually using the model before NASM had, adopted it into its current, methodology and what we know it at, today. So I actually got to start using it from its infancy. So, when we first started, some of the terminology was way deeper than anything I had ever learned in school. So I learned a ton of information from him. It was 7 phases versus what we're traditionally seeing right now in the CPT is 5. And basically because they took phase 1 and broke it into the CES, and then they took phase 7 and made it more in the PS, just because of the people that would usually fit within those phases. So, I mean, the thing is I've always used it, and because it works, and I've seen it work for people that were getting, post rehab, like right out of surgery, all the way to people at the highest level on the elite, the athlete standpoint, we've gotten nothing besides results. And it's mainly because we followed the system. And so once NASM adopted it into their education, I mean, it has exploded. And I think that the fact that everybody has the chance to use it and apply it is something that, that sometimes we take for granted because we've been doing it for so long.
Yeah, that's interesting. And I think we all have similar backgrounds. I classify myself as being third. Yeah, I think that's third generation NASM Master Instructor. And my experience was very similar. I worked as a chiropractor and found that people were coming back to my table with the same thing. So my search began as looking for that bridge so that people could go out and be healthy. I didn't want to see them after my time with them was over. I wanted them to be healthy and enjoy life. So what became the CES and the OPT model became that bridge for me, and I went into training. I started training people because of that system, like you had mentioned, Marty. So there are with anything that's popular or provides a certain viewpoint or system, we're going to have some detractors, and those detractors can perpetuate a couple myths, and we have a few myths about the model. Number one is that it is rigid. Can't use it for anything because it's rigid. So why don't we dive into that for a couple minutes? Let's start with you, Marty.
Excellent. That's a great point, because to me, it's the complete opposite of rigid. And what I mean by that is, just like anything else you want to learn, once you have a great understanding, then things open up to you. So when we talk about the model, is if you truly know the entire model, you practice the model, you can't find a phase of training in there that isn't part of other people's programmings. If somebody specifies in power, we have that. If someone specifies in movement preparation, the model has that. It has every type of flexibility. It has every type of resistance protocol in there. It's just the difference is we really focus on proper assessment, so we're not guessing. We look at movement deviation. The research shows us if people don't move well, they end up having a higher chance of all kinds of injuries that are preventable. We also know if there's movement dysfunction, that muscles aren't firing the right way and other muscles are working too hard. And that our job as fitness professionals, however that is, whether it's medical, like all three of us have our medical licenses that we can do different things, or if you're a fitness professional, your job is to make people move better. It's not necessarily to train a muscle, it's to train movement patterns. And we all know there's efficient movement patterns. So when you look at the model, we're fixing things and we're working on proper human movement in phase 1. Then we add weight or strength components to that new established proper human movement. And then we move well at high speeds in the power phase. I don't understand how logically someone could say, oh, you don't need to move well, or this is my movement pattern. I'm allowed to deviate. We would never take that. Like I always use the example when I teach, and Wendy's heard this 1,000 times. She's got to hear it one more time at least. Is when I look at a car, people take better care of their car. They're worried about, are the tires balanced? Is the right air pressure? Every 3 to 6 months, I'm going to go get my car balanced so it performs better. Why would we not have that same concept with our bodies? We could go into the really cool science, and maybe we'll add to this at some other point, like how stabilization intuitively makes me stronger, more powerful. Like that's how deep it is. But at the end of the day, it's just, to me, a little bit of common sense once you understand the science that we need to make people move well. We need to have the information so we can figure out how to make them move well. Then we load them. Then we let them move at high speeds. A lot more into it than that, but that's kind of like that 40,000 foot view of the model. So I find it hard to argue the rationale behind that sequence.
And what are your thoughts about the rigidity of the OPT model, Wendy?
Well, I mean, it's hard to follow or say anything different than what Marty just said. I mean, he pretty much answered it to a T. I mean, the thing is it's only rigid if you're closed-minded. And so, like Marty had mentioned, I mean, what makes us a little bit different and people think we're rigid is that we're saying you have to do this and these are the only exercises. And that's not the case. I mean, we're giving you examples in the textbook and examples in videos, but you can pretty much do any exercise that you want in the model. It just needs to fit your clientele. And so I think, people are like, well, I want to lift heavy and be explosive. And as Marty said, then that's fantastic. But let us build, a platform for you to do that and be, and excel in whatever sport or whatever profession you want to do. But let's just do it safely, efficiently, and effectively. And so, the thing is we're not rigid. We were known for a long time as just the ball people. And
it looks like we lost Wendy a second there. Looks like you're back. Are you back, Wendy?
Okay, I'm back. I'm back. So I don't know where it cut out, but basically we're not the ball people.
We're the ball people. Yes.
We are not the ball people. I mean, the thing is yeah, I mean, it's just a tool. A ball is a tool. Just like if you want to use TRX or any of the other things that are out there, you can use different types of tools within all phases of the model. It's really just how we have kind of slowed things down, added acute variables, added specific things to do in order to build specific adaptations to get you to whatever end results you want to have.
Yeah, and those are all very good points. And one thing that I did often when I was a master, when I was actively out in the field teaching, is I would inevitably get a power lifter in one of my workshops, and we would go through this exercise. So I'd say, hey, do you go out and do you lift your PR at the first when you initiate a cycle? No, you go through your movement slowly, you work on your weaknesses, you do a lot of assistance exercises so that eventually you can put more weight on. So what you're doing in the first couple of weeks of your program, that's what we call phase 1. In phase 2, you change the intensities a little bit, you start to drop your volume, then we're in level 2, phases 2, 3, and 4, and then eventually we get to phase 5, where you would be peaking for your meet, whereas someone who's following the OPT model would do more power exercises, work on more real life speed, and that sometimes created an aha moment. They bought in because they saw how that mapped directly to what they were doing already. And I think what you mentioned earlier, Marty, was just taking the veil away, removing the mystique, just diving in and learning the process takes care of a lot of the rigidity that people would experience. So the next point is that it's not challenging. Yeah, as we all laugh, I think each of us had a memory of going through one particular part of a phase and knowing how that felt afterwards. So let's, Wendy, why is the training within the model challenging?
Well, I think that kind of takes us from the very start. I mean, if you do an assessment on someone and you see that there's a ton of muscle imbalances, then that's an indicator that certain muscles are weak and other muscles are overactive, or I should say underactive and overactive. And so, again, we give you the solutions table to help you with identifying that. But as a trainer, if you can look at those muscles and you're like, you know what, this muscle is underactive and you need to activate it, then slowing everything down and activating a muscle that doesn't work is very, very challenging. I mean, in all reality, if you take 20 steps back and you look at a professional athlete, a trainer that hasn't really dove into the information would think, okay, because they're a pro athlete, they need to be doing power exercises. When in all reality, if you put them through a phase 1 or a phase 2 workout, depending on where they need to start, they're getting crushed. And it has nothing to do with how much they can lift externally, because those are muscle patterns that they know how to do because they've been doing it their whole life in their sport. So now let's take away all of that. Can they control and handle their own body weight at a slower tempo, really focusing on activating muscles that need to be activated, and just watch them, because it is amazing to see how, we had a pro ball player come to us that, he was a lineman for the Cardinals, and came to us, and we made him stronger and more powerful before he actually went back to camp by just doing phases 1 and 2, because he didn't have the right firing sequence. He didn't have muscles that were completely activating and working to their full potential. So once we got those activated, and then he went back to do the things that he knew how to do, people were calling and say, what did you do? And it's like, well, we just did some basic exercises. We did bridges. We did some single leg stuff. We did, things that he wasn't used to doing, and challenging those muscles. So the thing is when people say it's not challenging, they're not challenging their client. Plus, you got to think there are a ton of exercises that you can do per phase. And we, talk often about the neural continuum, because people get bored and it's always the same thing. But you need to challenge your client each time they come into the gym, still following the 4-2-1 tempo if they're in phase 1, and just watch it. And if you haven't done it yourself, try a 4-2-1 count push-up for 12 to 20 reps and see how you do.
Yeah, that was one of my memories. It snuck up on me once, but I don't think it'll happen again. And Marty, what do you say? What do you say about the challenge that OPT presents to people?
The thing that Wendy said, now, to add to that, because she did such a great job covering it, is when you look at those specific work to rest ratios, the time under tension, a lot of people would say, oh, it doesn't seem like a lot of work. Well, are you just counting repetitions? Or are you counting quality, time under tension? And we all know that there's 3 parts of a muscle contraction. We have the eccentric, isometric, concentric. By and large, most people, when they're in a facility, in a gym, they're maybe focusing on the concentric, but it's still not as much time under tension that we would give. But when you add in the isometric, which develops more tension in the muscle than the concentric, when you add the eccentric, which adds the most amount of tension in the muscle, they're missing out 2/3 of the muscle contraction spectrum that actually develop more force in the muscle than the one they may be focusing on. So all of a sudden you're doing 10 reps, but you could be under tension for 70 straight seconds with a very short rest interval. Now, the beauty of it, though, is I had some clients, and I've worked with professional athletes, my country club athletes, and they'd be like, oh, I'm not sore. And I'm like, okay. And they're like, so because they were just figuring more volume, more volume, more volume. There's no science to that. The science is, can I get you the exact point of fatigue that's appropriate, have you walk out appropriately fatigued, but come back refreshed? And that's the beauty of the model. It's going to prevent overtraining, because once you do these tempos with these rest intervals, you can't overtrain. So we know that there's a relationship between intensity, right, and volume. So a lot of people are in the gym for an hour and a half, but their time under tension is marginal compared to maybe a 30-minute condensed workout after you get through the warm-up and movement prep patterns. So the beauty is it's safer. And then we're going after very specific outcomes. We know exactly what type of muscle fiber types we're looking at. We challenge them appropriately, and that goes through the whole model. We won't have to dive into that now, because Wendy and I are going to get into that in other weeks. But it's so specific, it's like a sniper. I mean, it is just targeting in very specifically, hitting the bullseye, and then progressively moving people forward so they get the best outcome. So I call it hitting the easy button. The workouts are challenging. But my job is to get you the maximum amount of results with the least amount of effort. And what I mean by that is you're going to work, but you're not going to overtrain. And there's a progressive way I'm going to move you through to get you the best results possible.
That's brilliant. And actually, that's a perfect segue into our next point, that it takes too long. And I know that as I've been out there to some of the summits and interacting with people, one thing that I've noticed is that sometimes we allow ourselves to get into foam rolling, stretching, and phase one purgatory, and we never allow the client to move along, even when they're ready. So Marty, why don't you pick that back up and talk about why it doesn't take long at all to get a quality session?
Yeah. So one of the things that I really like that NASM has done over the last handful of years is we came out with our Master Trainer program. So that gives people an ability to come in and work with us live and see some advanced techniques with the model, because we do a tremendous job in the book going through what I'm going to call a best case scenario. And then there's, okay, now how do I add to that and go to the real life? So we really dive into that. And, we'll do more of that in meetings like this. Again, we have other stuff that we can do that in the live workshops. So let's say that I've been doing a couple weeks and I'm moving better, and maybe my upper body still needs a little phase one. That doesn't mean I can't start introducing phase two for lower body. So we can start to hybrid this model and do different things. The other thing too is if I'm doing a split, let's say I have a client that's only going to be in the gym for 45 minutes. I could try to have them get there 15 minutes earlier. They get their warm up out of the way that I've taught them. They don't need to pay me to do it and watch it. Or if it's just an upper body workout, because that's the way it's going to go, okay, maybe I don't need to address the lower body, those movement dysfunctions if we're doing just an upper body workout. So there's a lot of ways that we can hybrid the model and still follow the science. But I love, and Wendy knows this, she's taught me, I can go over the program design for hours. Don't laugh at me. Because it's so unique ways. And the way that I could say the model is, and Wendy touched on earlier, is the NASM model, regardless if it's OPT, CES, or PES, that's your toolbox. That's your system. That's what I call the cookbook. As you become a master, you know where to put your tools, whether it's suspension training, kettlebells, etc. Or if you're cooking, you know how to take the recipe out and not follow the recipe anymore. And you can jazz up the recipe with some extra things because you've mastered that technique because of training. So that's why I get so excited. You can tell my voice now about what people, if they really dive into the model, this thing becomes so unique in so many different ways that you can break it apart into 15-minute workouts, 30-minute workouts, hybrid phases. It just, are they following the right progression for them? And do you really know what makes up each one of those phases?
Sure, absolutely. Which brings us, you brought up a point about being a good cook, knowing what seasoning you want to bring into your recipe. And similar to that, being able to use a variety of exercises, which brings us to our last myth, or the last one we're going to talk about today. And that is, you can only use specific exercises. Those NASM people only use a step up curl to overhead press. What do you say about that, Wendy? What sorts of exercises are you using when you program?
Again, it's not just ball and balance, y'all. It's a little bit of everything. So the thing is, I think why people sometimes get caught up on it is because when we're going through, we say, like in phase one, for instance, when we're talking about core, core we use for activation, based on whatever the assessment shows to be underactive. And so we say that the best choices for these types of, in order to help build what we're calling intervertebral stability, which are just the little muscles that protect the spine, are to do exercises that have little to no spinal motion. And so, again, would be like planks and side planks and bridges. And again, there's a purpose and a focus based on research of why we say certain exercises are good in certain areas of the model. And I think because, we're kind of trying to teach people why, this might be better than just going and doing 500 crunches to build your abs, which we know later on could tear up your back. Why does that happen? And again, we want to look at the big spectrum. And so we're not trying to say that there's specific exercises, because the thing is, you can do anything. Again, be creative and bring in different exercises that you really like. It's just slow it down, look at the movement pattern, and then see, is it effective and efficient for your client? Again, everything should be based around the assessment and what you're finding. And then at that point, if there's an exercise you really want to do and it's beneficial based on your findings, then you should go for it, because there's really not one exercise. Well, I shouldn't say that. There are some exercises that should be probably removed from the history of ever being in a book. But I think, as trainers, the more creative we are, and the more that we want to, if we want to bring something in, we really just have to look, is it beneficial and does it fit within that phase? And if it does, put it in there. If not, maybe move it to another time and do it whenever the client gets stronger and can move better based on your assessment results.
Yeah, that's a perfect point. And one thing that I've always said to people is that look at what the phase is asking you to do. It's giving you a principle. Now, when you're doing your exercise programming, can that person perform that exercise and stick to the variables that are required at that phase? And if they can do that with proper technique, and it's based on their assessments, which we're going to talk about briefly in a second, then it's a good exercise for that. It's a good exercise for that phase. So if you think about it as a principle, and it doesn't make a difference what you do, just as long as you can stick to the principles of the phase. And that brings one more point that I wanted to make about that. We have a limited amount of exercises in the textbook, because if we put everything that you could possibly do, that book would be 4,000 pages, and no one would read it. No one would read it. So we have to limit that just to teach the principles of what's going on. But really, you can do whatever allows you to stick to that principle. Now, let's talk about assessments, because program design for me is driven by the assessment, how that person moves, their movement quality, and also their other attributes, their strength and endurance. Let's talk about assessments and why they are important before beginning any sort of training program. Let's start with you, Marty.
Certainly. So, key way I like to say it, if you're not assessing, you're guessing. So again, I have a medical background. I know Wendy and Prentiss both do, but I've always, want to say this in fitness. Our first task for our clients is to do no harm. So if we're just guessing, we're taking away a lot of information that may be pertinent to how to get this person to where they want to be. And sometimes where they want to be isn't where they need to be right now. So I kind of always say, rule one is do no harm. Rule number two is give them what they want while you give them what they need. And then rule three, make it fun, right? So that's where you can bring it together. So like if I went into the doctors today, don't want to do that today, of course, but I would hope there'd be an assessment process. It's not just like, you know what, Marty, today looks like migraine headache day. And I see trainers doing that all the time. It's like, today's leg day. Well, what if your 7 o'clock client has different needs and goals and abilities than your 8 o'clock person? So that's where we have to assess people to see where they're at. Then we take that information, we can create specific training and programming that will fix where their potential movement compensations are while we still get them through a tremendous workout. So I think sometimes the assessment process isn't done because people think, well, if I spend too much time doing that, I can't make them sweat. Oh, Wendy and I could both go through a corrective exercise session and sprinkle in other things that are absolutely safe, and we'll have people walk out drenched if that's what our potential goal is. But at the same time, we're working on fixing their movement patterns to get them ready to progress through the model as appropriate.
Mm-hmm.
Absolutely. And what do you think about that?
I mean, I'm 100% with Marty. I mean, again, we always term that, and probably because Marty and I have we think so much alike that I say the same thing. If you're not assessing, you're guessing. I mean, you need every assessment. It tells a story. And so it lets you know kind of a little more about a client that's separate from the subjective information when you're sitting down and you're speaking to them about what they do and kind of what their whole day looks like. I mean, if you see someone when they walk in and their feet are turned out and they've got a huge anterior pelvic tilt or shoulders around it or forward head, you have a good idea probably of what they're doing for a majority of their day. and they haven't even done a movement assessment yet. So I mean, when we think of assessments, they are all inclusive. It's not, you need to speak with them and find out, the background. And that's what we term the subjective information. And then the objective information of the assessments is the movement pattern. And if you don't have that, then you don't have a blueprint on how to build a program for your client. And that's what we really want to emphasize, that the assessment tells you exactly what you need to do. You just then need to apply it. And as Marty said in his rule number 3, make it fun. And so, I think a lot of times we get really caught up in, you're trying to stare at everyone's body and look at what's happening during the assessment. But once you gather that information, you need to talk to them in a very general, easy way for them to understand. Like, hey, based on our findings, this is what I think we need to do. This is going to help you get out of, your low back pain, or this is going to help you with your shoulder, because now I found some things that we can easily correct. So while we're correcting that, we're going to make you feel better. You're obviously going to move better. And then as a whole, you're going to perform better. So I think it's really, the assessments, I think, is the most important thing that a trainer can do, because that's truly where you're getting the information. And then within 4 to 6 weeks, when you reassess, you can see as a trainer if you're really helping them and seeing progress. Because if not, then you really need to reevaluate your program design and see what you need to do to get them back on track.
That's all good point. And Marty, real quick, I wanted to pick up on something that you said, and maybe this is something that a younger trainer, younger meaning time spent training, would do, and they would say, today's leg day. Mm-hmm. Did your assessment, today's leg day. It's in the book. This is what we're going to do. But what do you do if a client comes in and says, I'm a little sore, didn't get really good sleep last night. I don't think I can hit it like that. I mean, sure. How do you still proceed? And that's one of those in between assessments that I think trainers should do, just doing a little spot check at the beginning of the day to let you know that you may need to change course. What do you think about that?
Yeah, no, that's a great point. And kind of to tie in our last topic into this is, we have our formal movement assessments, but every single set, every single rep, if you're paying attention to your client, is assessments anyways. Because sometimes when fatigue sets in, you're going to see those faulty movement patterns again. So you should be assessing all the time, but then we have our formal assessments. But don't forget, you might see some unique things once fatigue starts to happen, or you start to give them a new exercise. So tying that in with what you're saying, Prentiss, is we could have our program designed perfectly and we have them follow the model. But, in my full-time job with Technogym, I might travel 200,000 miles a year prior to this. And I could have a great power phase workout ready to go. And if I didn't sleep or jet lag, I need to say, what is now appropriate for me to do that? So then that's the beauty of the model. That's why I get so excited, is we already have an answer built in. Peel back a phase. Peel back into something that is appropriate, or don't push somebody yet to the next step if they're not seeing what you should be seeing. So I had done a quick thing in my coffee talk. Someone asked a similar question. I said, you know what? I know you're focused on hypertrophy right now. Maybe your home gym isn't set up for that. Use the model to your advantage. Spend the next 2 to 4 weeks back in the stabilization phase, because that's very conducive with body weight, etc. Or maybe you move into the power phase if appropriate, because you can do your jumps and plyo, push-ups, etc. So the model is your answer, regardless of the why you may need to adjust. That's why, Wendy, myself, all the other instructors are so, rigid in the sense that we follow it, but we're not rigid because we have so many answers within the model. So I hope I answered that well.
Yes, you answered it. You answered it beautifully. So we're going to keep moving and we're going to dive into some commonly asked questions. These are questions that have come from our trainers. Just a couple of points that sometimes they're not clear on. And the first question is, or request is, to explain the difference between concentric, eccentric, and isometric muscle actions. And Wendy, why is it written backwards at times when we're reading tempos in the program design template?
Okay, so NASM didn't just throw these numbers in order to confuse people. It is always written eccentric, concentric, and isometric. Always. Oh, wait, I'm sorry. Eccentric, isometric, concentric. Always. And the reason is because that is something that we try to keep it consistent with what you're reading in science and with other industries. So if I just started saying, you know what, I'm going to do a 1, 2, 3 or 3, 2, 1 and whatever, and I hand that to another trainer, and it's nothing that's consistent in our training pattern, then you have no idea what you're doing. And so basically
Is everyone still there?
Yes.
Yes.
Okay, I can hear. We lost you for a second, Wendy.
You lost me?
Yes. All right. So I can't see Wendy and Marty right now. Just give me a thumbs up if you can hear me.
Yep.
I can hear you.
Okay. All right. I think, internet's not being nice here. So Wendy, please go on with your explanation.
So Greg, did I completely cut out then? I'm good. Okay, so I'm going to start over. So basically, concentric is the agonist. It is basically the prime mover. It is when the muscle is shortening. Isometric is when there's no visible movement. And then eccentric is when the muscle is lengthening, so your antagonist. And the thing is it's not written backwards. It is written with thinking about the agonist first, so the antagonist first, so the lengthening, so the eccentric contraction, then no movement, and then concentric. And so, for instance, if I'm doing a bicep curl and I'm doing a 4-2-1, if I came up onto the bicep curl, we would come up for 1, we would hold for 2, and then we would lengthen for 4. Because again, we are focusing on the eccentric contraction, because if you look at research and you read the text and you really kind of look at the muscles as a whole, especially when you're trying to increase strength and power, most injuries occur in the eccentric phase or contraction during deceleration. And so we focus on that first. And so the reason it's written eccentric, isometric, and concentric is because we want to keep it consistent with research. And so if we just started writing random numbers down, and then I have a client that I give to Marty because I'm going out of town and I want him to train her, we have to be consistent within the industry of when these, when the contraction should be emphasized in what we're doing. And so when you say written backwards, this is important for trainers to really think about what muscles we're focusing on. So if I'm doing a bicep curl and it's written 4-2-1 and you go to pick up the weights, well, technically, if I need to start with the 4 count, then I need to pick them up and my elbows need to be in a bent position, which isn't the case. When you pick up the dumbbells, your arms are straight. So you have to curl it, which would be the concentric motion. So when it says written backwards, that's why it's important to really think about the muscle that you're actually working. When you're doing a squat, then it's actually, quote, written the right way, because you're going to go down for 4, hold for 2, and then come up for 1. So it's taking time of really looking at the prime mover and what the muscle that you're working, what it's doing. And then at that point, you want to apply the correct count. And therefore, you're emphasizing and focusing on the right muscle.
Very good. Thank you for that. Now, going back to carrying on with muscle action, Marty, can you explain the difference between length tension relationships and force coupled relationships?
Absolutely. So going back to why the assessments are so important, that we want to get people to move better. And part of moving better is to restore normal or ideal posture, having all the joints aligned in the best position to carry load. When you do that, when you straighten up, as some people would say, get back into better posture, you're also not only getting the joints in the better position, you're also getting muscles to go back to their ideal resting position. And what that means is they're not over contracted and being pulled forward, or they're not being lengthened consistently. So when we have these normal length tension relationships, we know from research that the muscles now can fire better and more ideal. So now as we do that and start to train movement patterns, those force couple relationships where all of the muscles that are firing in a movement pattern around a joint fire sequentially in the right way, and now there's better movement patterns, and less stress on the individual joints. So again, even though people sometimes come in and want to work out and burn calories or work on their beach muscles, that's all phenomenal. But we know we get better results when the muscles are moving properly and have the right length tension relationships. So that's why, again, how flexible the model is. Doesn't matter what your goal is. Let's restore proper human movement, get the muscles to be in ideal position, take stress off the joints, get the central nervous system, which then can communicate better to those muscles, and then all these other goals will happen. So that's why it's so important to focus on posture, ideal movement, because you restore those proper length tension relationships.
And this next question this is a perfect segue. Following up with length tension relationships and force couples, Wendy, can you talk about the difference between what we term, or difference between shortened and lengthened muscle and over and underactive muscle?
Sure. So short and long is different from overactive and underactive, and so I know that's why there's so much confusion. But you want to think about the properties. So when we're thinking about short and long, we're thinking about mechanical properties, and so the length tension relationships that Marty was talking about. Like if they're short, then you're going to want to lengthen them, and if they're long, you're going to want to activate them. So when you're thinking about over and underactive, those are more neurological properties. So basically the ability of the muscle to be activated, and you want to kind of think of like muscle stimulation. And so, for example, like if you can have a muscle that is long and that is overactive, such as your hamstrings. Think about when your hamstrings are in an anterior pelvic tilt, the hamstrings itself feels tight, but it's in a lengthened position. So neurologically, we want to think about what can we do to calm that down. So that means that we're going to have to reduce the overactivity by inhibiting it, so foam rolling it. And then after that point, because it's in a lengthened position, then we need to activate that. So that's why, we typically refer to the muscle balances as overactive muscles and underactive muscles versus it being short and long.
Okay. And speaking of shortened, lengthened, overactive, underactive, Marty, can you talk about autogenic inhibition? What elicits that particular reflex in our muscles?
Yep, that's a great question. We address this in all of our warm-up phases, especially when we look at phase one, when we're looking at foam rolling as well as static stretching. So this is that scientific process by which a neural impulse, the senses tension is greater than the impulse that causes the muscle to contract. So breaking that down is the muscle itself is going to understand how much tension is there, and it'll cause itself to calm down. So this is an important phenomenon that we work on when we're doing static stretching, and that's really elicited by the muscle spindle.
Okay.
Short and sweet.
Okay, so yeah, short. Yeah, short and sweet. There's definitely a lot that goes into that, and I don't want to. When you get down to the muscle spindles and the different fiber types and the different stimuli that they respond to, we could talk probably 15, 20 minutes on that alone and how that elicits, how those responses to changes elicit certain spinal reflexes. It's just that your body responds to a phenomenon, and then because of that phenomenon, it inhibits the muscle, which allows it to decreases some of that neurological input. Okay, so Wendy, this one's for you. What are the basic training variables for the different phases of the OPT model? And we can talk a lot about that, but I know you can do this in 90 seconds.
Okay.
And they want to know specifically about sets, reps, and intensity.
So, obviously there are charts all throughout the book, and that's what I would actually tell people to go in and look at. I mean, because if not, I could sit here for an hour and tell you about every rep that there is and every set, why we do things. But let's take phase one, for example. We say 1 to 3 sets and that you're going to do 12 to 20 repetitions. And the reason we give you the 12 to 20 repetitions, people get so tied up in like, well, what intensity is that? Well, if you do, basically that is anywhere from 50 to 70% of the intensity that a person could technically do a 1 rep, what the 1 rep max is. So that's kind of how we came up with the intensities. And because most of your clients can't come in and do a 1 rep max, we wanted to be able to provide you with a good rep range to help your clients get into it, to get to specific goals. So, I mean, if you think about the intensity, 70% of clients, if they can lift 12 repetitions, that's 70% of what a client can normally lift. If they did anywhere from 20, that's probably 50% of what a person could lift. And the thing is if you go into phase 1 and you're doing the acute variable and you're looking at the tempo, and it's a very slow, controlled tempo at a 4-2-1, and you say that you want them to do 12, then that should be 70% of someone's intensity. But if they could do 13, then it should be heavier. Because the thing is people think in phase 1 you can't lift heavy. You can lift as heavy as a person can possibly lift. However, it has to be done with perfect form and without compensation. And so, again, when you're thinking about the basic training, the variables per the model, every phase is different because each phase, based on research, builds specific adaptations, and that's why you want to follow those acute variables so closely. That's probably longer than 90 seconds, and I kind of went everywhere. But
that is perfect. I want to answer a question really quickly, and then Marty, I'll get back to you. Archie wants to know, what is the school of thought on static stretching prior to resistance training? And I'm just going to throw a stock answer out there. It depends on how you're using it. Now, Archie, if you go out and you do static stretching, which does inhibit the muscle, it calms down the activity in the muscle, and you go out and do your max effort lift or your sprint or sprint or whatever that is, you're not going to have the same amount of, it's not going to have as good of an effect in your workout. If you use static stretching followed by dynamic warm-up, and then you do your warm-up sets appropriately to your working sets of strength training, static stretching is no problem. All that's doing is allowing you to access that full range of motion so that you can perform the way you want to during your weight training workout. So, Wendy, what do you say?
I mean, I think you pretty much nailed it. I mean, the thing is if you have a muscle that's overactive and short, overactive, and you like someone's foot turns out, and you statically stretch that muscle. Can you guys hear me?
Yes.
Okay, good. You statically stretch that muscle, and then you do some kind of active stretching, or as you said, dynamic stretching, and then you go out. You're actually going to perform better because you're stretching a muscle that's overactive. You're stretching it, and then you're activating it, and then you're going to perform. So I think everything else that you said was pretty spot on, but I would just include that as well. Okay.
Thank you for that, and hopefully, Archie, that answers your question. And Marty, back to you. What are muscle spindles? And we touched on that a little bit earlier. What are your muscle spindles and your Golgi tendon organs, your GTOs, and how do they function? Can you do that in 2 minutes?
I'll do it less than 2 minutes, just like last time. So muscle spindles and GTOs are both intertwined in the muscle, different areas. The muscle spindles are right inside the muscle belly itself, and they sense a change in length and the rate of length change. So going back to what we talked about, if they're under constant tension and they're being pulled on too long, it'll communicate with the central nervous system. And there's a couple different phenomena that can happen, but they may have to stay in a contracted state, and that's why we want to address which muscles we stretch properly. We don't just stretch everything, but they're communicating, and that's kind of what Wendy said. It'll feel tight. Well, that's that muscle spindle constantly being in a lengthened state, so it's measuring that. And at some point, they may lock down and prevent that muscle from being stretched too far. The Golgi tendon organ on the other side is in the tendon, obviously in the name, and it's going to sense how much tension is being built up in a muscle. So if I'm trying to lift a heavy weight and I can't move it, there's going to be that tension build up, and then sometimes the muscle just relaxes and somebody drops the weight. Not that they intended to. It's just that tendon was saying, hey, I'll let you have some pressure here. I'm going to protect myself at some point. When there's too much tension, I'm just going to cause that autogenic inhibition. I'm just going to create a relaxation because there's too much tension being built up. So one will protect you from increased length or rapid rate of length change. And then the GTO, that's the muscle spindle, then the GTO will prevent that rapid buildup in tension and protect you if it's too much. Now, in the CES, we'll talk about how we can use those to your advantage, but right now we're just talking about why they're there.
Yeah. Thank you for that, Marty. And I know that you have to hop off here shortly. So one more question for you. How do you learn the muscles? How do you learn the muscles and connect them to program design?
Awesome. That's a great question. So one, depending on your educational background, everything you need to know is in the course. So every time you design a program, think anatomically, think what muscles. Don't just say, oh, I'm going to train chest today. I'm going to just put it, go a little deeper with your clients. You can communicate that way with them. But as you go through, always go back to the different tables that are in the book. So go to your solutions table and start to really, and keep it on your clipboard if you have to. Think about it. Doctors have references that they access as they're doing their assessments of all of us. And so why can't we have those? And that's the way I memorized it. It was right on my clipboard, the solutions table, and I just kept looking into it. Then obviously going back to the resources you got provided by NASM, don't do rogue memorization. Don't just try to pass the test. Try to master the content. So every time you design a program, think about what movement patterns, what muscles am I trying to activate or inhibit, or so however you go through the phases. To me, repetition, and look for patterns, which you'll see. Just don't try to do rogue memorization.
Excellent. So I know, Marty, you have to jump off here right now. So does anyone have questions for Marty? And we're looking. Okay. So no questions for Marty. Thank you for hopping on today. I know you have other responsibilities to get to. So thank you, and we will see you for the next webinar in the series.
Look forward to it. Take care.
Take care.
Bye-bye.
So now it's just the two of us, Wendy and Greg. We lost. Wow, the view changed, so that's good. I was going to make a Brady Bunch reference, and but it looks like we have Mike and Carol, and it looks like I'm off to the corner on my screen, so I must be Jan. And the next question is for, of course, well, you're the only one here, Wendy, unless you want to answer questions, Greg. So how are the calves, going back to assessments, and to novice trainers, some of the solutions, some of the findings may be counterintuitive. And this question is asking, how are the calves involved during an excessive forward lean? Why isn't it just the hip?
Sure. Well, you want to think about the ankles itself, and there's around 20 degrees of dorsiflexion in the ankle to have ideal movement in that specific joint. And as we often see, and a very common compensation is someone is lacking that range of motion. And so because they are lacking the 20 degrees of dorsiflexion, when you go down into a squat, you also want to think about what's happening at the shin, right? So the shin should go forward and then you sit back. And so that's why we look for those parallel lines. Well, if you don't have that range of motion in your ankles and they stop, but a client's like, look how far I can go. If they don't have that motion in the joint at the ankle, then what's going to happen is they fall forward with their torso, and that's how we get the excessive forward lean. So basically, it's because we're lacking range of motion in the ankle, and we're trying to show how low we can go. That's what usually, or how they're involved.
And it's as honestly, it's just as simple as that.
Right?
It's as simple as that. Your body doesn't really care about your movement impairments or your compensations. It's going to your brain's going to find the best way to accomplish a goal. And that is to lean forward to get down. And that's if you're lacking mobility in that ankle, you will lean forward, just as Wendy said. Okay, and I think we only have a couple more questions, or maybe one more. Let's take one more. This is a big one.
Oh, great.
So,
thanks, Marty.
and this is all you.
This
is all you. I'm just going to sit back and listen. How do you categorize the exercises from each area? Core, balance, plyo, SAQ, and resistance. And this particular listener, it doesn't really know how to apply this concept to exercises they may see on the web. So how do you do it?
Well, this is a pretty deep question, and so I'm going to try to see if I can find a very general, basic answer. It really comes back to really understanding the concepts and the textbook. Because again, we do put certain parameters around different exercises within the model because they serve a specific purpose. And so again, going back to the phase one, when you're thinking about core, what exercises are out there that doesn't have a lot of spinal movement? That would be something that's appropriate because again, we're looking for that intervertebral stability and not having a lot of movement. So therefore, we can activate muscles that are underactive based on our assessments. And so, when you think about that and you're looking at just core alone, in phase one, it's little to no joint motion. In phase 2, 3, and 4, there is motion of the spine. So we're working more global muscles that protect the spine, that can move the spine. And then when you get to power, you're thinking about that same movement, but now with more speed. And so any of the exercises that you find and you're working on core, it's like think about where that should, where you could put that exercise where it would fit best. And then the same thing with balance, little to no motion of the stance leg in phase one. So anything that you do standing on one leg, and it could be a bicep curl to press, you could do so many different things, but you're still focusing things being on one leg. That's phase one. And then phase 2, 3, and 4, there's now movement of that stance leg. So a single leg squat, a lunge to balance, but there's always a balance component to it. And then when you think about, obviously, when we get to power, people get confused when you think of balance because you're hopping, but then you're holding that, and it's mainly you hold it to see if you own it. And so anything that's a hop, and it can be in any plane of motion, is appropriate for the phase 5 balance. And then again, when you're thinking about reactive, the reason why we have the stabilization in phase 1, you do a powerful explosive movement, but then you hold it. And it's mainly you hold it to see if you own it. And if not, you correct it. And so the more that you do those repetitive movements, the more it teaches your brain and your muscles how to play together nicely and start incorporating that newfound length and you start to make that a pattern. And so once you have done that for 4 to 6 weeks, and then you go to phases 2, 3, and 4, you're doing more repetitive motion. So now you're actually adding movement to it. And then again, you're doing explosive in 5. And so look at core, balance, and reactive as kind of the warm up, the extended warm up. And then when you get to the resistance, there are specific principles that you want to look at. And again, it's because we're building specific adaptations. And that's by going through the textbook and really looking at the rep ranges and the speeds and the tempos and the intensity to know how much weight this person should lift is so important. Because in phase 1, we do a lot of balance training or stability work. And it's mainly to make sure the stabilizers are really working well with the prime movers, because you need that before you go into 2 to really maximize that strength endurance, where it does really focus prime movers and stabilizers together and then doing that superset. And then the same thing, you want hypertrophy, you have to be strong and you have to be stable in order to gain size, along with nutrition, of course. And then again, same thing when you get to, max strength and then power. So the thing is it's really hard to say, I'm not sure where this exercise belongs, because again, you can do a push-up in all 5 phases. But if you slow it down and put a specific, tempo to it, it's going to have a different type of outcome than if I'm doing a 4-2-1 count slow push-up versus just a strength push-up that's a 202, and then an explosive push-up, a plyo push-up and power. Still the same exercise. It's just you're doing something different.
That's a great answer. And just leading, or just let's follow up on this point a little bit. And one thing that I've always challenged some of our candidates to do in the Master Trainer Summit is to, and this is also a good way to practice these parts of integrated training and to practice the various levels of training is the concept, and you touched on it, and let's dive a little bit deeper on it. It's the concept of progression and regression. Taking a simple push-up, for example, you should be able, if you understand the principle, to do a variation of a push-up for all five phases of training. So can you talk a little bit about progression, regression, exercise selection, and how this fits into that previous question?
Certainly. So again, if we take the push-up and we talk about regressed, everyone just assumes that the most basic exercise for a push-up would be doing a push-up on the knees. And again, just think, you get a bodybuilder, you get a guy that comes into the gym, and you tell this guy to do a push-up on the knees, he's not going to be very thrilled about that, especially if his buddies are around, people are looking at him. And so you want to think, okay, how can I regress an exercise and also think about the client and how they would feel in certain types of situations. And so instead of doing a push-up on the floor, which obviously would be easier than a push-up on the toes, if they're going to compensate and they're not strong enough, then you want to actually go into more of an elevated type push-up. And so you could do a push-up on the bench, or if it's someone that really likes to lift weights with a bar, then just do push-ups on a bar, so therefore they're at an angle, which is going to make gravity less, which makes that easy, or that particular exercise easier. So doing a push-up on the wall, doing a push-up on the bench, a bar, dropping to the knees, those are regressed push-ups. Again, focusing on, if we're in phase 1, the 4-2-1 tempo. Again, because think about the control and all the muscles that have to fire in order to maintain proper stability in the 5 kinetic chain checkpoint alignment. And so, there's so many variations. You can also do a push-up on a ball with your hands on the ball. If you do that, you're actually elevated. So it's easier for a gravity, on a gravity standpoint, because you're not on the ground. However, the stability component of it makes it super challenging. And so again, you can have a lot of fun with certain exercises. It's just you want to think about the outcome, and then obviously the time under tension that Marty spoke about. So again, going kind of back to your question, if you go into strength and you want to do a push-up, again, you're making the push-up faster, so you know that they're going to have better form. But then weight it, put a weight vest on. I don't say weight your back. A lot of people do that at the gym, and they start throwing 45-pound weights on someone's back. That's really probably not the best way of doing it, because it can cause a lot of pressure on the spine. But there's a lot of fun and different ways that you can do any exercise of your choice. Yeah. That I think would be beneficial. Mm-hmm.
Yeah, and one thing that keeping with the push-up example, one thing that I've always challenged people to do is, you want to do phase 5 or phases 4 and 5 of a push-up. Why aren't you doing? You don't necessarily have to add weight to something. You can definitely change the leverages and make that push-up a little more difficult. # single arm push-up. So so there are definitely many opportunities with very basic exercises to increase the challenge.
Oh, absolutely.
Without doing a bunch of different things.
Yeah.
So that's an important concept for a trainer, a newer trainer, to pick up. So right now we have a couple minutes left. Are there any other questions that anyone wants to have answered today? Nothing in the chat. Well, I want to say thank you for for being on today, Wendy. We're going to do several more of these. Like we've said in previous conversations, I think we've talked more to each other in the past 3 months than we have in the last 10 years. So, and
I enjoy every minute, Prentiss.
We're like siblings. We don't argue like siblings, but I appreciate always the conversations, the insights, and lost my earpiece there. I appreciate the conversations and the insights, and thank you for putting up with me the last several months. Do you have any parting words?
I think basically, if anyone has any questions or the model, because can you hear me now?
You had one job.
I know, right? Can you guys hear me now?
Yeah, I can hear you.
I'm telling you, I think basically it's really just going through and applying each and trying each and every phase out, because you really don't have an appreciation until you do it. You realize that phase 1 is really challenging, and phase 2, maybe I think one of the hardest phases personally in the model from what I've seen from my clients as well as for myself. I think too, if anyone has any questions, let us know, because we really want to help everyone. We want people to use the model. We want them to feel comfortable with it, so it becomes second nature. It's only going to help build your business, and it's also going to help your clients, get to the goals that they truly want to accomplish.
That is good. So speaking of questions, how are they going to reach out to you if they have any questions after this?
Prentiss.Rhodes no, I'm just kidding. You can.
But seriously, you can, if you like videos of me dancing with my daughter, if you want to ask questions, I post exercise videos once in a while up there. You can contact me on Instagram at Dr. P. Rhodes. You can contact me there, and I am responsive. I will answer you there. So how do they get in touch with you, Wendy?
Wendy.bats13 is my Instagram. WendyBats13 is Twitter. Or you guys can always email me at wendy.bats@nasm.org.
Okay. Well, that is all for today. Thank you very much. And Wendy, I will see you next week. Thanks, everybody.
Sounds great.
Have a great day. Be safe.
Bye.